Hi, good afternoon, and welcome everyone to another episode of the NCITE 2024 Speaker Series, Building Resilience in the Counterterrorism Workforce. My name is Erin Grace, and I will be your host today. I want to run through a few housekeeping items before we get to our fantastic guests. And so you're watching on the Zoom webinar platform. This is a one-to-many platform, and so if you do have questions, please put them in the Q&A. We'll do a moderated Q&A toward the end of this program. We also send out a recap, written recap with a video following this to everybody who registered. So if you logged on late or have to leave early, no worries. We've got your back here. You'll also be able to find this stored on our website under our events, where we have a repository of all of our past speaker series events. I'm really excited to have with us today two amazing NCITE researchers who are expert in something I think we all need right now, which is a little resilience. Their focus, of course, is with the counterterrorism workforce, resilience in that field, given the difficulties. And so here to talk about it will be Joe Young. He is a professor at the University of Kentucky and director of the Patterson School of Diplomacy and International Commerce. Hi, Joe. Good to see you. He seeks to understand the cross-national causes and consequences of political violence. He's a data scientist and expert in political violence, and his work has been funded in part by NCITE. Next up, we have Dr. Daisy Muibu. Daisy is an assistant professor of security studies. Hi, Daisy. And NCITE principal investigator. Her areas of expertise, of course, are counterterrorism, countering violent extremism, the stabilization of fragile and conflict-affected states, security sector governance, and in the East and Horn of Africa regions in particular. And her work has been funded in part by NCITE. And so today they have paired up to discuss their latest, results in the NCITE project that's been going on for some time now, where they are trying to get a baseline of how counterterrorism practitioners are coping with the demands of their jobs. They want to discuss their most recent deliverable, which has to do with peer support programs. And I know all of us listening are thinking, well, of course, a peer would be somebody that would make us feel better about the demanding nature of our jobs. But they're really going to drill into the how and the why of this. And so to kick us off, I'd like to start with Dr. Muibu. If you can just tell us what peer support is, how effective it is for law enforcement, what potential impacts it may have.
Thank you. Can you hear me all right? Wonderful, great. So thank you for having us here today. Before I begin, I just want to take a very brief moment to thank NCITE and the Department of Homeland Security for the incredible support they provided us this past year, and actually the first 2 years doing a lot of this work. And also a big shout out to our incredible team of experts, practitioners, and students who have been very consequential in sort of how we've designed and executed our work. Now, to answer your question, peer support more broadly and very directly deals with work-related stressors or stressors that impact one's work. And it tends to be addressed by peers of a similar occupation. And so it specifically refers to more structured, often very formal programs where individuals with shared professional identities or experiences can connect regarding occupational specific issues. And it's for this reason that peer support often includes training peers to be peer support mentors or peer support providers. And so these are those individuals that will deliver support and know-how to be able to identify and address any common issues they may face. In the case of law enforcement, this usually involves recruiting officers to serve as peer support providers or mentors and providing them with training to be able to serve most effectively in these roles. The benefit of using peer support is that it helps to decrease the stigma and hesitancy around help seeking. And this is because those that have shared experience are usually more uniquely situated in their understanding to be able to empathize more closely with what an individual is going through. And so one thing I do want to caveat when we're talking about peer support is that it goes beyond informal support from non-work related family or friends, because peer support members tend to be more focused on delivering a certain set of often formalized or trained support, including being able to deal with, being able to identify mental health issues and providing more structured support. But it's also important to note that this support is not the same as professional mental health care, nor is it intended to replace other types of professional mental health care. I think there's a second part of your question, which is what impact does peer support have in terms of what impact can it have? And we went about trying to understand the efficacy that peer support can have to address work-related mental health strains that law enforcement officers can experience, and amongst other groups. But let's focus on law enforcement particularly. And we found three things. We found that generally, when we look at the existing evidence based on peer support programs for law enforcement, is that they generally have positive outcomes for reducing work-related mental health strains. We found that the success of peer support is most often tied to it not only being accessible, but being able to be provide a trusted platform where peers can meet with peers to discuss their issues. But also this question about guaranteed confidentiality means a lot. And so we found that officers who engage in peer support programs had lower scores of PTSD, depression, anxiety compared to officers who did not use or have access to the same. But we also found that peer support can encourage help-seeking behavior, in that it not just encourages people to take on peer support, but it can also help folks want to even get more professional mental health support beyond peer support. But that stigma remains a major challenge and barrier to entry, which is not surprising. And lastly, to conclude, we found that peer support programs, how they're designed and implemented, can vary in very significant ways. So one peer support program may not look like the next or the other. And this can be in the fact that in some cases, peer support is delivered by officers within the same department. Sometimes it's delivered by peers external to the immediate organization or department. It can be used in group settings, one-on-one situations, virtually, over the phone, in person. And also the type of training provided to peer support providers can vary by both type and duration. And so there's a lot of variation in how peer support can look like. Thank you.
Thank you, Dr. Muibu. Dr. Young, talk about how you dug into understanding how peer support looks like in general, and then in particular with one of the components you're working with. What method did you use? And tell us a little bit about how you even evaluate these programs.
Yeah, well, Daisy did a great job explaining a bunch of the things we're doing, but also thanking lots of folks. But I want to thank two folks as well, you as well, because we did a lot of prep for this, and it seems seamless, hopefully, to everybody else, but there's a lot of work that goes into it. So thank you, Aaron. And the other the other group I want to thank is the 80 plus people that are here, which I think is a testament to the importance of this topic, but also people are deciding on a Thursday afternoon to spend an hour talking and thinking about this, and that I'm really grateful for that. So, yeah, I'll just say we were tasked with trying to examine how this exposure to violence affects our counterterrorism workforce. And so we try to do this in a couple of different ways. And the first is through a systematic review, which Daisy really headed up, so she can, if there are specific questions about the real detailed pieces of the methodology, we're happy to do that. But probably to save people a little bit of time, I'll just say it's a very structured and replicable analysis of the literature. And we went through all of the literature on peer support programs and tried to identify the things that work and the things that don't. And what we want to try and figure out, obviously, is how this we know a ton about how direct exposure to violence affects people. We know a lot less about how this indirect exposure affects people. And so we wanted to know about this, how peer support programs can help with mitigating the effects of these indirect exposure to violence, especially, kind of doing this systematic review. And so we did that. But we also we also examined programs in the federal government that were tasked with supporting counterterrorism professionals who are indirectly exposed to violence. And we won't necessarily name names, but with one particular program, we performed what's called an evaluability assessment to outline their theory of change that they proposed, and to see if the program that they implement could be rigorously evaluated based on their theory of change, and we could see whether the things they hope they're doing, they're doing. And so both the systematic review and the evaluability assessment are available, and I'm sure they're going to be available via NCITE soonish if they're not already. At least I'm pretty sure the systematic review is already ready. But these will be available for other folks if other folks are interested. But again, the core is to try and figure out whether these programs are doing the things they're doing, and how we can best know this.
Well, thank you very much. I want to invite our audience who are listening to just pop questions into the Q&A as you have them. We decided to go against kind of a lecture format, but just get right into the nitty-gritty. And boy, you two are succinct, and I can't always say that. So thank you for some succinct answers, because we do want to get to what's on people's minds when it comes to peer support. Just to stick with you for a second, Dr. Young, you mentioned direct and indirect exposure to violence. I know that probably seems self-explanatory, but could you define what you mean by that?
Yeah, and I think most people are pretty familiar. I'm guessing everybody in the audience is familiar with, what we would call primary or direct trauma, and that's likely familiar. And that's people experiencing violence, abuse, and other trauma. And a classic example of that is, right, PTSD for our veterans of foreign wars. They experience something really horrible in combat, and they have a hard time managing and dealing with that down the line. But secondary traumatic stress or vicarious trauma might be a little more new to folks. Maybe many of the people on this call are familiar with those concepts, but these concepts come out of counseling and other helping professions where individuals help people who experience direct trauma, but this help involves listening to them, seeing or grappling with others' traumatic experiences. And this secondary traumatic stress can present similar, kind of like PTSD. And so when these helpers are repeatedly exposed to STS or to secondary traumatic stress, the cumulative effect becomes what we then call vicarious trauma, which similarly is a change in a person's worldview and can lead to some pretty bad outcomes, things like depression, poor work performance, other mental health challenges. And so, again, sometimes we don't think about how, and in our case, thinking about counterterrorism professionals, that there's potentially costs associated with viewing these kinds of materials, hearing firsthand accounts of violence, or reading transcripts of violent materials, watching videos of someone doing something horrible to someone else. And so these are all examples of kind of this secondary exposure, and that's really what we're interested in.
Thank you very much. I would like you both to weigh in on the idea of stigma and how that prevents people from getting help, how peer support can overcome that. But sticking with this idea of secondary trauma or indirect, so you're not in the line of fire, you're not the police officer, you might not be the boots on the ground, but you're listening to the boots on the ground. And so how does that actually add to the stigma of seeking help? What have you seen? And why don't we start with you, Dr. Muibu, and then go to you, Dr. Young.
Absolutely. For a lot of the folks who are involved in this line of work when it comes to counterterrorism, it's the people who are highly motivated and deeply motivated to serve their country, really, and be able to do so in a way that can be able to protect lives or make some sort of an impact. So they do feel a lot of value congruence with their work. And folks who do feel that way will be willing to, in some ways, it can serve as a protective factor when they're experiencing a lot of indirect exposure to violence, or sometimes even direct exposure, whether it is they're watching videos or traveling to locations that are higher at risk, or whatever their work day to day will entail. So recognizing that this is sort of the archetype of individuals that sort of self-select into these jobs, there is a high motivation for folks to be able to serve in a way that is not accepting of this idea that perhaps they will need to get help, mostly because they're there to be the helpers. And we know historically for some of these professions, being able to address mental health related issues perhaps was not perceived in the most positive light. And so there is this need to, one, a very positive, a very personal drive to be able to do this work in a way that is meaningful and be able to have an impact that would make it less likely that someone would say that maybe I need some help, right? Because they're there to serve. But then there's also the broader culture that can exist that would perhaps make it difficult for one person to be able to seek out more formal mental health or even peer support, mental health support. Now, it's important to note that this is changing, and this is something that we've come across throughout our studies, whether it was through our surveys that we have done amongst counterterrorism practitioners or our in-depth interviews we've done with practitioners across intelligence, military, law enforcement backgrounds, is that there is this slow change. Now, of course, there would be some demographic differences between folks who choose to seek mental health support or not, or say that they need support or be able to overcome the stigma of asking for support. There can be a generational divide with folks who are younger into the industry, just culturally not having as much of a mental barrier to be seeking help. But it's a change. There is positive movement towards reducing stigma, but there still is stigma, is what we're finding. Joe, do you think there's anything else that you'd like to add on that?
Well, that was fantastic, Daisy. And I think a couple of things I just want to emphasize because what you're saying is so important. And the first bit is where I completely agree with you is um, I think today people are much more comfortable sharing unpleasant things. You know, in the old days, I think there was a much more of a machismo vibe around these things, and that was sort of the source of the stigma. I think that's sort of melting away, which is, I would argue, a good thing. And as Daisy was suggesting, that a lot of the stigma is related more to the fact that this is a purpose-driven occupation. And if you're saying that I'm doing this larger purpose, this thing for the greater good, it makes like, well, why should I seek help? You know, I'm trying to do something great for people. I'm not affected by these things. So I think that's right. You know, and I think one other point to add there is that each of us has kind of a different threshold. And, you know, what's upsetting to me may not be upsetting to Daisy or vice versa. And it doesn't make my thing worse or better or any of those things. It's just there are different things that affect us in different ways. This is something we know out of biomedical research, is you give the same person or two different people the same drug and they have different reactions. And it's the same with this sort of violence and this sort of secondary violence, is you give it to two different people and they might have different reactions. And so one thing, and I'm not necessarily suggesting we do this or mandate it, but it's just an idea that has come out of some of our discussions, especially with practitioners in other countries, is that some places require whether it's peer support or seeing a therapist after a really traumatic event. So they don't make stigma an issue because they require people to get that help. And that's a way to sort of take it out of people's hands and say, you know, you could potentially like could not feel bad about it, and you could see somebody and be like, I'm good. Or you could be, you know, really affected, and there could be stigma associated with trying to do it. And because you had an opportunity to do it, that you get the help that you need. So that's another thing that's happening in the world.
Thank you. That's really, these are really great answers. You know, one of the things that occurred to me, somebody was sharing an FBI video on resilience on this very subject yesterday, and just watching those powerful testimonies of first responders who had gone to, say, the Pulse nightclub shooting or other violent events, how much they masked how they really felt so that when those systems were in place to check in on them, how they really felt that they couldn't until it had kind of gotten to a crisis stage with them. We're starting to see questions pop in, and I'm happy. So audience, please keep filling the Q&A up. And I'm glad that Brendan Leach asked this because it was on my mind too. So intuitively, we know that talking to a friend about a difficult thing can help, and talking to someone who works in our sphere, who knows, as you said in one of your reports, they get it. It really helps. But tell us, what are the hallmarks of good peer support programs? What were elements that you saw in your research?
Absolutely. Good peer support programs, one, have confidentiality, right? Like that is number one. I think it cut across all the fact that I mentioned that there's various different modalities of these programs in terms of who exactly is delivering the peer support, how much training have they received, or what venue does the peer support occur, whether it's a group setting, individual. Across all of that, confidentiality matters. And I think that's a hallmark of a good peer support program. I think a second hallmark of it, and this is something that came across a lot with us talking with our partners within those DHS components, is that peer support programs are not swapped out for formal mental health support. That they are not supposed to be, that's too much to put to someone who's not licensed or trained to be a clinician. So they do serve a pretty important function of being able to provide support that can actually show noticeable reduction in both psychological and physiological symptoms of stress, but they are not supposed to serve as an alternative to more formal mental health support. And in some settings, you see, at least from what we looked at when we're looking at the evidence base that exists out there, is that some peer support programs have clinicians as part of the team. And they help not only design the training that peer support providers receive, but they also help serve as sort of a way to be able to indicate when a peer support member it's time for you to move that individual from receiving peer support and move them over to receiving formal support, so that they can help peer support providers or peer support members, or the term that is used across different places, the person delivering the peer support, help them be able to gauge when somebody needs a bit more formal support. So I think that's a second thing that we can say that is a good hallmark of peer support. And I think a third factor that I would say is that good peer support is driven by trained peer support providers. And I say this, initially, I think we can think about, and there's a lot of literature that exists about this, just having social support. And social support matters a lot. And when we talk about social support, we're talking about like informal support. So through your friends and family, and sometimes your friends can be your colleagues, right? You're in and out, who understands what you're doing more than them, right? You're in and out of them. And that can be very, very valuable for you having that social support. But peer support is distinct from that in that it is often a bit more formalized. It's a little bit more thought through. And often peer support providers tend to have some sort of baseline training. And I think one of the biggest factors that came out from sort of this last year or two of doing this work, and Joe, you can let me know if I'm missing anything, is that you want to have peer support providers who understand the boundaries around which they can deliver support. Is there at some point when you're meeting somebody and talking to them about the challenges that they're experiencing, when do you need to know to move them along to somebody else who can deliver more support than you can provide yourself? And how can you, as a peer support provider yourself, protect yourself from even experiencing some of what Dr. Young was mentioning about vicarious trauma and secondary traumatic stress? So it's those three things I would say: confidentiality, I forgot the second one, but the third, the confidentiality, also making sure that your peers are trained, and forgive me, I forgot the second one, but I guess it was a good point as well. Thank you.
Joe, do you have anything to add to that?
That was a fantastic list. I mean, I would just add one thing, which one of the peer support programs that we're familiar with they also have kind of peer support kind of for normal times, and then they have peer support for pretty, like, let's say, crisis moments. And so there may be like a rapid response team that gets involved if there's a really, we were just talking about this earlier, Aaron, but the killing that just happened in New York City, there, probably FBI on site who had to witness and see pretty horrible things. And that might be a moment where a rapid response team would come in and sort of check on everybody and provide that peer support.
I was wondering, listening to both of you talk, is that do you have to, if you are in law enforcement or counterterrorism, do you have to luck into working for an agency that just has this baked into their processes? So that's one question. I imagine this is not required, but some have it and some don't. So what have you found there? And then the second thing is, for any of our listeners, how do you get one started? What have you found has been useful in places that didn't have one that wanted it?
I'll let you
Daisy.
do this one first, please.
Oh, okay. All right. Thanks, Daisy. um, well, I think what I've noticed, and again, this has been, I think peer support programs have been around for decades. And some of the older ones, I think, were started by people who just felt very, very strongly about this. And there were these champions in different organizations that developed it. Now, I think today, and Daisy, you can correct me, but I think today it's much more common that you see it in an organization. They'll have some form of it. But I still think there's probably a path dependency and a history of a place that had like a really strong champion who said, we need to do this, and here's a program, and we'll invest in it, and we'll talk about whether we need to assess it and how we can make the trainings better and all those kinds of things. And so I think getting it started is probably related to talking to some of these and I don't know if well, we'll say old school champions, how they did it, what they've learned from doing it, the kind of costs and benefits of doing it. There are different, and I hesitate to name again anybody, but there are different organizations that kind of work across agencies that deal with this. And so there is kind of a network too of people working in these spaces that aren't particular to a particular agency. Yeah. So Daisy, I don't know if you want to jump in there. You're muted.
Apologies. I think you got most of it. I don't think I have anything to add. You got it.
Daisy, by the way, your second thing, I think, was knowing when to move from peer support to the professional. I think you both have made an excellent point here that the peer is not a licensed mental health practitioner, they're a peer. And at some point, that you do need to bring in the expert for this. And Joe, I'm glad you did bring up New York, because I was thinking that just in general, take it out of the context of the subjects of your study, counterterrorism, but just to all of us are in the soup, and we are consuming violence at a remarkable pace. I mean, just this last calendar year, we've had 2 wars in two different parts of the world with unsparing detail and video. If anybody was on the New York Times website yesterday trying to track what was happening, they actually posted the video of the shooting on the New York Times so that a casual consumer or reader would see that. And so, are you noticing that in general we are seeing more cases of stress or burnout compared to the past, or is it just my sense of sensory overload, anecdotally?
Well, I think, thanks for the question, Aaron. I definitely agree. And just like we try and eat healthy things to keep our bodies strong and doing all the things that we need our body to do, what we consume, I think, in our media and in our spare time and what have you, also affects us. And consuming this amount of violence, there's no way to get away from it. Even if you're not a counterterrorism professional, even if you're just you and me, and we hop on the New York Times website, or we see what's happening in the war in Gaza, that's going to affect us. And so I think really staying in touch with that, and kind of, as we said before, seeking help if you're feeling really bothered by it. And that could be through talking to friends, it could be seeing a therapist, it could be cuddling your pet, it could be taking a long walk. it doesn't have to be something as formal, but just to check in with yourself to say, hey, this is really affecting me. And I think, and Daisy and I wrote about this in a different venue, but I think especially in areas where, and I've not a lot of time, but I spent a good amount of time in the Middle East, and especially, I've been to the West Bank and Israel, and so I see people that I've seen in other contexts potentially dying, and that affects me in a way that probably watching another area wouldn't affect me in the same way. And so I think really checking in with yourself on these kinds of things, and then trying to seek help, or use strategies that are going to mitigate the effects of that. I don't. The last part of your question though is, are we seeing more of this? I don't know. I mean, because remember, during the Vietnam War time, they were broadcasting dead bodies on live TV, right? So I don't know. Maybe we are, or maybe, especially if people are looking for it, you could probably look at it a lot on YouTube or TikTok or whatever. Um, but I think the bigger part is just checking in with yourself, and then also kind of going back to one of the points I made earlier, is realizing that what affects you is going to be a little different than what affects someone else. So, someone else could be like, I don't get why this is a big deal. It's just some, people that are dead on the screen. And you're like, I know that's a deeply, that moves me and affects me. And I think just being in touch with that.
Thank you. Daisy, what would you say to those questions?
I think I would say a lot of the same thing. I think Joe makes a really good point about, is it more than it was in the past? I think the Vietnam example is a useful one. Certainly, maybe with social media, I think it can ramp up how much you do have access on this. You could just be, I think, more of younger folks who sort of are on Instagram or TikTok, and if you're just trying to look at puppies, and then all of a sudden you're looking at Darfur or Sudan or what's happening in Gaza, that can be jarring. And so I do think there is for the casual person maybe more opportunity or more venues, let's say, to be able to come across this. But then I think about beyond just the common folks, if I can take it back a little bit to some of our research with counterterrorism practitioners, we in our in-depth interviews that we did with folks, one thing that we tried to really understand and help is how people cope. We understand that there's this organizational level support that you can receive, but what do individuals do for themselves? And I think there we saw a lot of interesting things that echo a lot of what Joe was mentioning, not just formal mental health support, but a lot of people mentioned being active, being outside. Some people mentioned avoiding media, including social media and the news. Other people said actually engaging in media and social media was a useful tool. A lot of folks mentioned time with family, time with friends. So there's these things that are very routine, and I think the obvious things that maybe we already know that we're doing, but I think that can also be quite helpful. And this is not to deter anyone from seeking more formal mental health, but it's also just to state that there's other coping skills that we probably employ on a day-to-day basis that practitioners in the field, some of whom are very, very affected, mentioned, including also faith. Some people mentioned developing a faith and really leaning into it has been particularly helpful.
Okay, I've got a hat trick, a three-part question here for you, so bear with me, okay? And thank you to our viewers. They're just peppering us with questions. I'm going to fold in a couple plus one of my own here. There's a question about what kind of mitigating factors might one have a resilience factor up front before the event happens that might help. So that's one. The second part of that is your own personal experience. So how has being in this work, I mean, being immersed in the work that you're doing obviously gives you secondary trauma experiences. Writing about secondary trauma may do that too. So, how have you both personally dealt with traumatic material? What have you found worked for you personally? And then any new reflections to share. So, first, just in general, what protective factors might people come to the table with? Knowing, Joe, like you said, everyone's different. And P.S., I know I should eat vegetables, and I don't do a great job. I like cookies this time of year. And then two, how has your personal experience shaped your own absorption of these tough things and then your own ability to deal with them? And Joe, why don't you go and then Daisy?
Okay. Um, so the first part of the what mitigating factors you're saying, like what sort of personal characteristics might be a mitigating factor, or
Let's go to the question. Well, it just disappeared off my radar. So
okay.
I think it was just my read of it was, recollection of it was just in general, what are you coming to the table with that might help you in what is, objectively a tough field?
Yeah. So I mean, I think one thing which is kind of the opposite of mitigating factor, but someone who's had personal histories with trauma is going to affect you if you are then, secondarily exposed to it. This is something we found in our survey work. And so yeah, I think, being aware of who you are and what your past experiences are that could be potentially influencing your future, I think is important. I think having some of these resilient skills that Daisy has spoken about, I think a lot of us in this field use a lot of gallows humor, which it's there's also skills that are coping skills which aren't positive, right? Like a classic one is drinking, like, okay, this has been a rough day, let's go drink 6 beers, right? Like that's not a very healthy coping skill. I'm not, it's not as bad as some of the alternatives, but it's not a positive coping skill. Um, so there are things we can do that are better than that. Um, I think from my own personal experience in dealing with this, I find, things that are helpful are things like taking breaks, limiting the amount of time I spend working on these things, and then moving into doing, some of my job is just like any other job is office work and boring and annoying and all those other things. So I take breaks by doing those boring and annoying things. Um, and like Daisy was saying too, exercise, take walks. I know it affects me personally at times where and Daisy, I don't, hopefully I'm not outing you, Daisy, but Daisy and I are friends too. We don't just work together. And Daisy knows my wife pretty well. And one time we were at a party and there were people around and I was telling a joke and my wife turned to me and she goes, "Do you notice how people aren't laughing?" And I said, "Yeah." And she's like, that joke might be a little too violent." And I was like, "Oh, okay." Right. Like this is affecting me in a way that I don't even fully, understand. And sometimes I need a little feedback from other people, like to step back and go, I'm not quite normal. And that not quite normal is probably being involved in this world where I'm constantly exposed to violent material. And in some ways, maybe I cope with it, but I also need to be aware of how it makes me maybe not normal in party situations.
Yeah, I mean, I think Joe covered a lot of it. What I'll try and talk about is I'll try not to repeat what he says and maybe add a bit more about what if you're an organization and you're a person who's working within an organization. I think we think about organizational level support and what an individual can do for themselves. But I think one thing that came out when we had a workshop where we brought in folks from different DHS components, some folks from ODNI, and we also brought in some folks from outside of government spaces just to sort of have a conversation and a workshop on this. And I think what was illuminating for me is when some folks made it very clear that organizations can actually create space to support individuals build up their coping skills. And so it's not as much as we think about it neatly as what can you do for yourself as an individual, and then what can the organization do for you more structurally. Well, it seems as though the organization can create space for individuals to have opportunities to cope more. And that could be just, working around sort of what the workday looks like, sort of how often individuals can be able to take breaks between watching violent videos, how much autonomy an individual has over how much violent materials they can consume, and how they can communicate that, understanding that everybody has a different threshold. Understanding that even how people have different threshold with different content, like Joe was alluding to. And so maybe someone can say, well, I can look at that case of you know mass shooting case, but I can't look at that case that involves young children being affected. And sometimes a job is a job, and unfortunately, you can't necessarily have that flexibility in being able to select for yourself, and managers may not even have the bandwidth to be able to allocate you to certain tasks and not tasks. So I think we're also being very conscious about that reality. But it's just thinking about how the organization can support an individual's that they're also investing in, right, to be able to achieve the mission. And so these are just some things that we heard from folks who are in decision-making positions in sort of helping to facilitate the support, or are big advocates within their own agencies in trying to push for it. How can the organization support an individual in building up their resilience? But I know that the question was also like, how can you have resilience up front? And I think there's a distinction here to be made between coping skills that can help build up your resilience, and what Joe was alluding to earlier, which is what resilience do you just come with yourself. And I think just coming in at a baseline, I think the ultimate answer is what Joe alluded to earlier, that everybody's at different levels, and we need to accept that. And it's not someone is stronger or weaker, or sort of those pejorative languages. It's just acknowledging that some people can cope differently because they come with different levels of resilience. In terms of personal experience, I think, when Joe and I were cooking up this plan, I think the to do this study, it came from most of our work, right? We realized that we study a very similar phenomenon, but we look at it or have approached it in somewhat different ways. Though Joe has traveled also to locations that are at risk, he's also a data scientist, so he also spends a lot of time with data sets, big, large end data sets, looking at these issue sets. I spent most of my research in the field, in sub-Saharan Africa, mostly in the Horn in Somalia. And so we just sort of had a conversation and understanding that, like, we were exposed to violence, but different types of violence. And we were very curious in how being exposed differently to different types of violence can affect us. And so Joe's did a good job of, personally discussing an anecdote about how it affects him. And I think the same is for me. It's just being able to acknowledge how it affects me, even in ways I'm not very conscious of, but then automatically thinking, okay, what about practitioners who sort of us doing this day in, day out? This is their bread and butter. And I think our research found that we do know that they're exposed and are affected, but maybe not to the extent to which we initially thought they would be exposed to, in terms of how frequently and how many different types of violent materials they're exposed to.
Thank you. What thoughtful answers, and thank you both for your work in this, because it's just so vital and important as we go forward. I'm wondering, as we kind of wrap up here, if you have any final thoughts that you'd like to share, including if you want to make a plug for a program. We will share out some of your research in our recap so people can kind of see it there. But Joe, why don't we start with you, and with Daisy, what haven't we covered here?
Well, thanks again, everybody, for coming, and thanks, Aaron, again for hosting us, and to my good friend and partner Daisy. You know, I think the thought I want to leave us with is that this isn't about just being touchy-feely and understanding people's feelings, and this is about securing our country, right? I mean, that's what really at its base we're interested in. And we realize that people that are hurting and are, mentally unhealthy and are struggling in their jobs can't do that job well. And so it, I want to help people. That's partly why I do what I do. But at the core, what I want is a safe and secure country. That's why, I'm grateful to be involved in the work that NCITE does. And so, I think it's important that we remember that the final goal here is to have a very strong, resilient, secure counterterrorism community, because what they're doing is vital to the safety and security of our country.
Yeah, I'll just echo that. It's true, we had many different arms to our research, and I think all of the arms are really trying to investigate and understand this issue. And I think it has been not just a privilege to be able to do this research work, but I think it has been incredibly and uniquely informative to be able to talk to a diversity of folks from across the different interagencies, and also who are even outside of government, who have this mandate to understand, prevent, or respond to political violence or terrorism, just to keep our country safe. And I think the education for us has been in seeing that how this could negatively impact work performance, job satisfaction, job retention. People change careers and leave careers because of this. But I think what has been most encouraging, because we both set out saying that we just didn't want to do research to just say, oh, it's bad and then end there. It's also to try to understand ways to be able to mitigate this. And I think, we are such a small cog in a broader machinery of people who are so passionate and driven about being able to address this. And I think that has been very encouraging. Whether it's a peer support program that we're assessing, to looking at the folks that we've spoken to through our interviews or through our workshops. They're people that are very driven in being able to actually address these issue sets, so that we can have a stronger workforce that is even more resilient. They're already very resilient. Let's start off there, but even more resilient, so that we can be able to tackle current and emerging threats.
Both of you said this very, very well. I am so grateful for your time here today, and grateful for what you said about why are we doing this in the first place. And to our viewers who may not know, NCITE is a Homeland Security funded Center of Excellence for Counterterrorism Research, and our portfolio is vast, and we cover a lot of different topics under that counterterrorism umbrella. Certainly, supporting the workforce is one, and so there is a reason for this science into resiliency in the workforce. As you said, Joe, we want to keep the country safe, and Daisy, we want to keep people in their jobs. And we don't have this discussion about how they might get physically injured in the field. And if that happens, of course, I know this is kind of an old trope, but there are ways to take care of those physical injuries. Less in our public discussion still, even though we've made strides in how we deal with mental health in this country and talk about mental health, is this very thing. And so I'm really grateful to you both for coming. I'm grateful to our audience who showed up. I want to remind everybody you can learn more on our website at unomaha.edu/NCITE. You can email us at the email you see on your screen, ncite@unomaha.edu, and we will be sending out a recap with some of Joe and Daisy's work attached to it, along with a copy of this video. So thanks, everyone. Thank you, Joe and Daisy, and hope everybody has a great rest of your week.
Thank you.
Thank you.